Hi everyone, I'm Ramya Mukara and I'm excited to share our work from HAP786 workshop in health informatics. Alongside my teammates Deepali, Naidu, Pushpal and Kurian, we contributed to the project Removable Algorithm Bias, focusing on African American group. Let me walk you through the details of our project and the key contributions we have made. Our project aims to tackle algorithm bias in AI systems, particularly focusing on predicting antidepressant responses for African American populations. The underrepresentation of African Americans in mental health research often leads to inequities in treatment recommendations. By leveraging the data from the All of Us research program, our goal is to develop predictive models that are fair, inclusive, and promote equity in mental health care.
Building smarter AI solutions for depression management. Our initiative focuses on developing an innovative AI system to revolutionize depression management through five critical projects. Here is the glance of each project. Common AI challenges focuses on improving the intake phase for data collection and processing, ensuring reliable and accurate diagnosis. Analyze missing values addresses the issue of incomplete data by developing methods to fill gaps without any compromise in system reliability. Remove algorithm bias. This is where our project fits in. We worked on identifying and eliminating biases that lead to inequitable treatment recommendations, particularly for African American populations. Actionable AI advice enhances the practicality of AI recommendations, making them evidence based and usable for clinicians in real world settings. Coming to the follow up mechanisms, this project automates follow ups and tracks treatment outcomes to ensure the consistent patient engagement. These five components together aim to transform depression management, making it more effective, personalized, and accessible. Coming to the project overview, let's start with the focus of the project. Algorithm bias has been significant challenge in healthcare AI systems. These biases often result in inequitable outcomes, particularly for underrepresented groups like African Americans. Our goal is to address these disparities and improve the fairness in mental health outcomes. Coming to the data source, the foundation of our project is the data we have used. We leverage the information from all of us research program, and this program is a rich, diverse data set that allows us to create model representative of all the populations, especially those often excluded from the traditional research. Here are the main activities we undertook, like we analyze the patterns of antidepressant usage and treatment adherence. We also develop predictive models that are designed to eliminate bias and promote equity. These steps ensure our recommendations are fair, inclusive, and evidence based. And why is this work important? African Americans have been underrepresented in mental health research for far too long. This underrepresentation has contributed to disparities in treatment outcomes. Our project aims to bridge these gaps, ensuring that mental health care becomes equitable and effective for under-reserved populations. At this point, I would like to hand over to my teammate Deepali Naidu, who will discuss more on the technical aspects of our work and its broader implications.
In this project, data preparation was a critical first step. We began by extracting and standardizing key data, including demographic, clinical, and treatment related variables from the All of Us dataset. Handling missing data was a priority, and we used advanced statistical imputation techniques to ensure data completeness and reliability. To enhance predictive accuracy, feature engineering played a major role. We created new variables and addressed multicollinearity to avoid redundancy in our models. For statistical modeling, lasso regression was used for feature selection, helping us focus on the most relevant predictors, while logistic regression evaluated emission outcomes. Lastly, we carefully assessed performance metrics to measure model accuracy and fairness, ensuring the results were unbiased and robust. Data preparation and cleaning. Our data came from the All of Us dataset, focusing on demographic, drug exposure, and condition tables. We designed a custom data frame AD_dates_DF to track individual antidepressant trials, ensuring comprehensive data structuring. Precise calculations were enabled by assigning appropriate data types to variables like dates and dosage days. We also created specialized functions to calculate dosage duration and manage data for participants undergoing multiple trials. Importantly, our inclusion criteria focused on African American participants with at least 70 days of antidepressant exposure, aligning with our objective to address underrepresented populations in psychopharmacology. Coming to statistical modeling and evaluation, we employed logistic regression models to predict remission outcomes, leveraging a combination of demographic variables, comorbid health conditions, and antidepressant categories. Demographics such as age and gender, along with 20 selected health indicators, served as key predictors, while drug categories included amitriptyline and others. We also considered the impact of concurrent antidepressant usage as a potential confounding factor. Model performance was evaluated using McFadden's R-square for goodness of fit, providing insights into the variance explained by our model. Additionally, metrics like accuracy, precision, and recall highlighted the effectiveness and reliability of our predictions. These methods ensured our approach was both statistically rigorous and clinically meaningful.
So coming to the results, our study included a total sample of 3,357 participants with a focused analysis on African Americans. The results revealed three major predictors of remission. First, medication adherence emerged as a crucial factor. Participants who adhered to their antidepressant regimen for over 70 days experienced a 72% remission rate. Second, age played a significant role. Individuals aged 41 to 64 had the highest response rates, possibly due to the factors like stability in health seeking behavior and fewer extreme age related variables. Lastly, several comorbid conditions were shown to influence remission. These findings emphasize the importance of accounting for pre-existing health conditions in treatment planning. Among the antidepressants were analyzed, amitriptyline showed promising results with McFadden's R-square value of 0.0567, while nortriptyline had the highest precision of 69%. These insights highlighted how targeted, personalized treatment approaches can improve outcomes for African American patients and address disparities in mental health treatment. We found significant differences in how well these drugs performed. For example, amitriptyline demonstrated moderate accuracy of 64%, while trazodone had the highest accuracy at 72%. Nortriptyline stood out for its strongest precision, achieving 69%. Interestingly, the category labeled Other, which included combined antidepressants, had the best overall performance with an accuracy of 82% and a McFadden's R-square value of 0.1704. These results emphasize the importance of tailoring predictive models to specific drugs and patient characteristics. By doing so, we can better guide clinicians in selecting the most effective treatments. However, we also notice some limitations such as moderate McFadden's R-square values, which suggest that the models do not fully capture the complexities of antidepressant response. This highlights the need for further refinement in predictive algorithms to improve accuracy and fairness. In this final slide, we summarize the key insights and future directions. Firstly, adherence to antidepressants was confirmed as a critical predictor of remission, reinforcing the importance of patient education and adherence support programs. Age and comorbidities were also significant predictors, aligning with prior research and emphasizing the need for personalized care. Despite these insights, the moderate McFadden R-square values indicate room for improvement in our models. Incorporating additional variables such as socioeconomic factors or genetic data could help address this limitation. Looking ahead, we aim to expand this research to other population subgroups such as Hispanics or Asians to further explore predictors of antidepressant efficacy. Additionally, integrating genomic data from the All of Us research program could provide deeper insight into pharmacogenomic factors affecting treatment response. In conclusion, our findings underline the importance of personalized, equitable healthcare solutions and set the stage for more comprehensive and inclusive mental health interventions. These are our references. I would like to add, I'm incredibly proud of the work we've done as a team. This project highlights the importance of innovation and inclusivity in healthcare, and it's exciting to be part of shaping the future for AI-driven mental health care. I'd love to hear your thoughts, feedback, or experiences in leveraging AI for healthcare equity. Let's connect and collaborate. Thank you.